Hey everybody, this is Dr. Shrigani Rheumatology. I'm an at Rheumatology, and today I'm going to talk about osteoporosis. Osteoporosis is basically when you have brittle bone. So if you could see on the screen here, on the right, you have very thick bone, and on the left here, you have very brittle, spongy bone. Naturally, people develop spongy, osteopenic, osteoporosis bone with age. Most common in women, as when you become postmenopausal, around 50 to 65 years of age, the bone starts to lose estrogen and becomes very brittle. Men also sometimes are at risk of having brittle bone or osteoporosis, but definitely the lack of estrogen in women is the more significant risk factor. So we go and screen women of postmenopausal age for osteoporosis using a bone density scan. And when you do a bone density scan, it tells you how thick the bone is on the bone density. And the common areas where the bone density measures is the most common areas of fracture. So I'm going to use my friend Bones here and just show you the areas that the bone density looks at. So the areas it looks at is your lumbar spine, L1, 2, 3, 4, 5. It looks at the bone here, and it looks just at the texture of the bone as I just described. Is it spongy or thick? And basically the bone density or DEXA scan gives you a bunch of scores. A T-score of negative 2.5 or worse is considered osteoporosis, and a T-score between negative 1.5 and negative 2.5 is called osteopenia. Osteopenia is basically a precursor of osteoporosis, where you're basically doing weight-bearing exercises to grow bone, calcium, vitamin D. But once you get to osteoporosis, you start to talk about treatment options to grow bone or preserve bone from further breaking down. So the bone density again looks at the L1, 2, 3, 4, 5 bones, it looks at the texture, and it also picks out a hip joint to look at. It looks at the hip joint where the ball goes into the socket here. So it looks at the ball of the femur, and it looks at the neck of the femur, because people can fracture the ball or the neck. So you get a separate score for the ball or the total hip, and you get a femoral neck score as well. And also the forearm bone density is taken. So they usually look at the most common area of fracture, which is like 1/3 of the radius. So around here of the radius, they get a score there as well. So these are the three areas of bone density looks at, and it gives you a bunch of scores. So usually we screen women over the age of 65 for osteoporosis using bone density, but sometimes women can have other risk factors for early menopause. So somebody that has history of rheumatoid arthritis or steroid use, such as prednisone for COPD, people with early menopause, family history of hip fracture. So there's certain reasons where you can get a early bone density if needed. The typical treatment options are, we call anti-resorptive medications, which are regular osteoporosis medications. It's called anti-resorptive, and it stops further bone breakdown. And then we have very strong medications called anabolic agents, such as Evenity and parathyroid hormone analogs, Tymlos, Forteo, which we use. So for regular osteoporosis, negative 2.5 to negative 2.9 bone density scores, we typically use bisphosphonates or Prolia. And for severe osteoporosis with scores of negative 3.0 or worse, or a history of a spine fracture, or what we call a fragility fracture, where somebody breaks a bone for no reason, that doesn't really make sense, such as a standing fall or a wrist fracture from a standing fall, or just having a compression fracture in the spine. These are called fragility fractures, and we may be more prone to using an anabolic or stronger medication for the osteoporosis up front, rather than a regular anti-resorptive medication such as Prolia or bisphosphonate. This is basically osteoporosis diagnosis and treatment summarized. If any questions about osteoporosis diagnosis and treatment, leave a comment below. If you're looking for osteoporosis treatment, come check us out at Rheumatology, and we'll take care of you. Take care, and thank you.